maybe Anthony would like to introduce.
Bring it on.
I think if you don't stand there, I'll be fine. All right. So I think we're on camera now.
X-Smart.
So this is Victoria from the Skagit. She's also with Hidalgo Bay Medical Center.
Hidalgo Medical
Associates. Excuse me. And Anacortes.
I'm part of Island Hospital, so we're one of the sister clinics out there. I've worked out there coming 5 years this April.
She's also the vice president of the Skagit chapter.
I am.
Yeah, and keeps things moving.
Yes, we all try our best since we're still a new chapter. This will be our second year coming.
Yeah, they're doing great.
This is her
They really are.
second year as the vice president.
Yes, I am.
Yes. Well,
That's
she
been
kind
moving me towards
of
president.
signed up for a couple of years at that level.
Yes,
She's
exactly.
doing a great job, as are all of
And
them.
their chapter has a lot of attendance, which is really good.
Really,
We try.
you're doing great.
Thanks.
You really are.
It's the speakers. We try to get really good speakers. You know, it's a hit and miss
And-
and everything else. So if you can
Such
make
a
it.
variety.
Yeah, it is.
It's
I'm working on this next coming year to see if we can get it going.
Cool.
So,
So today she's going to be talking about immunizations.
yes,
So I'll let her take it over from here.
Well, let's still running. I did give you guys some handouts. It's just a brush of things that I give out to patients personally, and some info. I mean, they're all basic information that you've all gone through during school. Location, the site, right medication, and then right now where there's a big controversy of to vaccinate or not to vaccinate. So it's a big thing that we talked in the office. So for me personally, I get lots of questions, like new moms. That's the biggest one. Is would you do it? I don't have children, so I would tell them honestly, but I would vaccinate. I have a dog. I vaccinate him. And it's just because on a scientific standpoint, for our education, we're told to vaccinate so that we can eliminate bad things to come. So 2-3 years ago, MMR popped out of nowhere, first case in a long time in the U.S. About 5 years ago, there was pertussis, and a lot of people didn't vaccinate their children. At 11 is when we start giving the Tdap, and that's where the pertussis vaccine. And there was lots of cases here locally too. So as far as I know, there's been a minimum case of positive pertussis in the valley. I guess when pertussis was a hot thing, Skagit Valley was one of the biggest counties that had the majority of the cases in the state of Washington. So once that popped up, people were coming in and getting vaccinations left and right. So, and we still give it. We also recommend pregnant ladies at 27 weeks when we give it to them. Again, if they've had it at the youngest age of, or the latest age of 21, we give it to them again for every pregnancy. So that's recommended by the CDC. It's the chance of them passing the antibodies to the baby. It protects mom because when she gives birth, she's open, she's exposed to a lot of things, even in a sterile place. We still want to protect her. And then we recommend family members who may be in contact with the baby to get vaccinated as well. I like to tell them that even though you may have some antibodies into the baby, the chance of that person who hasn't been vaccinated can be a carrier and can pass it to the baby. Because they'll take the first dose of vaccines, other than Hep B at birth, is at 2 months. So you're really leaving a big window for them to be exposed and maybe in contact with a virus.
So this is the one that I see advertised on TV about whooping cough and all. I mean, they have this lovely impression of this grandma picking up this baby, and then grandma changes into a wolf, and it's a nasty, but it's very impressive. So it's interesting.
I don't force it on them.
No, but I'm just trying to. I had no idea about vaccinating the pregnant mother at that point.
It's just protection. I mean, we do get a lot of no's, same thing with the flu vaccine, but it's our part to educate our patients, and then educate the family members as well if they're in the room. So I'll log in. I was gonna do it old school and just talk, but then
See?
Dave just
I
told me.
ya. I was wrong.
Dave was like, "Are you gonna do PowerPoint?" I was like, "No." Yes, I'll do it.
Everybody claps.
I have to do this.
Oh, gosh, nice, Harry and David. Good, all right.
I got a catalog in the mail the other day, and my dad's like, "Who's this?" And I was like, "Oh, I bought that years ago." It's still good. Princess. You know, I'm clicking too fast. So I'll be jumping in and out with the power slides. There's just so much information, and if I'm talking too fast, just let me know. When I'm on the hot spot, I tend to gibber. So here we go. You guys see that?
Yeah, trick.
Let's see here. Maybe I can show the power. Oh, it's showing me as a PDF. Okay. We'll work with it. Is that all visible to everybody?
Mm-hmm.
Yeah? Alright, here we go. So, vaccinations in pediatrics. So, one of the biggest things that we want to focus on are the 6 rights. Right patient, right medication, right dose, right route, right time, and documentation. Always document. That has been a savior to me a lot of times, and I'll tell you why later. So right patient, you do want to check with the name on the chart. My biggest one is gender. So many times that I cannot read the kid's name, but also there are so many names that are current right now that can be boy or girl. So that's the biggest one. If I call out a name, I want to make sure that I get the right gender, because then a lot of times every parent gets up because they're all anticipating to have somebody call out their child, and they're not even listening to see your face, and you're like, oh, that could be me. So there's been plenty of times where I have picked up the wrong child just based on the name. So I've learned that lesson. 2 identifiers, last name, birthday. I will try my best to talk to the child if they will respond to me. A lot of times they're really shy, but I'll try to communicate with them, and then I'll ask them like, oh, do you know your birthday? And sometimes they do, and they'll tell me, and it gets them really involved because they feel important. Same thing with name. I'll ask for their name, and then if they know how to spell it. If they don't want to talk to me, I'll give them a paper, and I'll let them write their name if they could. And then it's also something for them to do something in between while I'm talking to the parent, so it gets them a little distracted, so that way it gets them less nervous in the room. And same thing, I'll ask the parents too, if I'm talking to like an infant who can't speak for themselves. Right medication, you do want to check the label. We have one refrigerator that holds all of our vaccination, and a lot of times you're so much in a hurry that you're just grabbing these by muscle memory, and there has been times that I have grabbed the wrong one, and I'll look at it again, and it's the wrong one because somebody reorganized the tray, and that does happen a lot. And then check the order. One of our pediatrician physicians, he orders them himself. And a lot of times other physicians will just trust that it's the right one, and then they'll recheck it again at the very end to make sure that you order the right one. And then in our bylaws, it is that the physician has to make that order. So unless you still get the verbal order, it'll be okay. And then right dose, check the order and confirm the appropriate dose. So lots of vaccinations are 0.5 milliliters. The flu vaccine is 0.25 if it's the first dose for an infant between 6 months and 35 months. The reason why we do it for 2 doses if it's the first one is the first one's an introductory, so then that way they can build antibodies, and then the second one is just to confirm everything, so then that way their immune system is not compromised if they may have a reaction to the vaccine. And then adults are 0.5 or 1 milliliter depending on the vaccine. And then check the order again, because majority of the vaccines are IM, and then the ones that are sub-Q are measles, mumps, rubella, and varicella. So it goes in the back of the leg right here, in the fatty tissue. If those are for infants, for teens or toddlers, they can go in the arm if they have the good deltoid or not. But I do like to ask them where they would like it, if they have a preference. If you have a challenging one, safe bet is the thighs. So that way, patient secure, patient safe, you're safe when given the vaccine. And then always ask for help if you have a challenge with the patient. Sometimes parents will tell you to, if they're going to give you a difficult time. So listen to the parents, because you also want them to be comfortable. I float in multiple departments, so a lot of times parents, when they see me, they're like, "Oh, you're new." I'm like, "No, I've been here. You just don't see me." But it's good to build confidence in the parents, so then that way they're comfortable with it and not have to worry. And some parents, they do have their favorites too, so they'll ask, like, "Oh, can I have Kevin do it instead, because he's done it this whole entire time, so I feel comfortable with him," and I'm okay with that. A lot of times with vaccines, especially with new parents, I'll call them the day after I'll give the vaccines, just so then we can build that relationship with each other, and then they feel comfortable and confident that we do care for them, instead of just wanting to vaccinate them and then get them out the door. So I've had a lot of parents appreciate it. I just started that not that long ago, to start calling if I have a chance, and then I'll tell them afterwards too, like, if you have any questions, call us. We're here till 5. If it's after hours, call us anyways. It'll kick over to the hospital part, and there'll be an on-call doctor, and then a lot of times it'll kick over to the children's hospital. And they're totally comfortable with that. And then if they do call children's hospital, they'll send a report, and then I'll call them back again, just to be sure everything's okay. And then also confirm, check order again, confirm patient can take or receive medication ordered, or the parent. It's good to ask parents if they've had a reaction from the last time, too, to see if there was any response. If so, then we can probably spread it out if parents are uncomfortable, or give it to a different site. So I have some links here, see if it works. See it pop in here. So this is one of the handouts that you guys may be sharing. If you guys are not comfortable where the vaccines are going, you can use this resource. A lot of needles that I use is 5/8, just because it's smaller for infants. Depending on the size of their muscle, then I'll move up to a 1/2 inch. And then I personally don't go up to 1 inch unless they have like really good muscle tone. I would say young adolescents. Like for you, I would use a 1 inch. So you got good deltoids right there.
You'd be a good boy.
Yeah. So if you are uncomfortable or not familiar, this is a really good resource. And then same thing for IM. You want to go at a 90-degree angle. Sub-Q, you want to go at 45. Towards the very end, I'll show you ways to, I don't want to say restrain, but like hold the child down safely, so then that way you have all the visible spots for you, so that way you can see it.
She's good at that. She's trapped.
Yes. And vaccinating children or toddlers or young kids, it's a two-part thing. Like I said, it's to keep you safe, keep the patient safe, and make sure that we get into them. And here's the second one. So this one you can use to how to administer subcutaneous vaccine. Just different resources. It's a good site. So for an adult, you do it right here in the deltoid. IM right here, and the vastus lateralis for the toddlers. More information is always great. Sub-Q right here for the behind the arms for adults, for adolescents, and then behind the leg here for toddlers. A lot of times when I tell parents if it's their first dose of the MMR or varicella, the ones behind the leg, I'll ask them to observe the child, make sure they're not scratching it. And if they do, go ahead and put jeans on or sweatpants or layers, because the more that they touch it, because it hurts, they can't help it. It's just an automatic thing. If something itches, you just scratch it. It's good to them to avoid it as much as possible, so then that way it doesn't irritate any more swelling in that top spot. Here we go. Right time. So one of the calendars I have there, this is the visual that I use on and I give to parents. It's a really easy one to give to parents because it'll let them know what they're coming in for every well-child visit. I'll give them a copy. It's so easy to read, and then that way they can anticipate what they're going to get at that visit. So a lot of times parents like to prepare the child. I've had parents give the kids, Tylenol or ibuprofen before they're seen, or have it ready for afterwards too. We don't usually recommend Tylenol or ibuprofen to anybody younger than 6 months. So I would say pacifier, or you could breastfeed right afterwards, or have a bottle ready afterwards too, so that way they have that association and disruption. When it comes to vaccines, it takes lots and lots of practice. So parents are always wanting to have it done as fast as possible. But it's everybody does it differently. So, and I'll show it to you guys afterwards too, and how I manage it. And over time, the more that you do it, the better you get. Yeah, always check for frequency in order, double check for order, and confirm last dose. So a lot of the vaccines that you see here on the calendar, you'll notice lots of duplicates. When it says confirm last dose, we want to make sure that they got at the right age and time from the first dose. Because sometimes if we give a vaccine too soon, we would have to repeat that.
Yep, it's invalid.
Right. And then parents will get upset if we have to do it again. So it's one extra shot or one more visit that's inconvenient for them. A really big one is the roto. If they haven't had their first rotavirus, and it's an oral medication at 2 months, if they haven't gotten it, they can't continue it just because they've grown out of it. And then the last dose, they can get it at 8 months. So yesterday I discovered this child did not come in for their 4-month-old child. So we're kind of like on a small time crunch right there. So I'm like, okay, well, you can come here, and he's already at 6 months. We can do this, and then if you want the vaccine, make sure you make an appointment before he turns 8 months or exactly 8 months. So that way it's appropriate. Because a lot of these vaccines, we can't give them any sooner, between 4 to 8 months, or 4 to 8 weeks, excuse me. But that's why we spread them out so far, so then that way we want to make sure that they didn't get a reaction, the body's accepting it, and then, make parents not feel like they're in the office so often. And then influenza, the big thing right now, is a quadrivalent. Last year, not a lot of people vaccinate in my office because parents chose not to, and it's okay. But this year, a lot of people are getting vaccinated because they learned that it's the quadrivalent, so it covers you 4 different strains. And last year, it was unfortunate that one of the strains mutated. So there was a lot of question on that, too. That I'm like, well, I heard this on the TV. I don't have television, but when I hear this, it gets me really upset, like, darn TV. And I'll say to them, like, even though one of them mutated, you're still protected by 2 of the other. And the flu, if you do get it, it won't be as bad compared to the actual flu. And if all of us remember, the flu sucks. Like, I remember my... Yep. Yeah, you can. And I remember my last one, and it was the worst feeling ever. So even I had the flu shot, I felt like I protected myself, and it could have been worse. Parents, they still have that option. And then, again, to educate them, like, you still have different times that you can come in. If you don't do it now, you can always come back. You don't have to see the doctor. We can have you visit a nurse, and then she'll vaccinate, or you can go to any of the pharmacies, and you can do that then. But if you want to wait longer to see, if you want to collect more data for yourself. So, yeah.
So do you deal mostly, it sounds like kind of that you're dealing with a family unit, not just the child necessarily. So you're dealing with like a mama and possibly a daddy and the baby and maybe even a sibling along the way to make sure that everybody is on the same kind of vaccination thing, especially with the flu thing. Is that correct? Or, you know, to make sure that the whole unit is protected?
Right.
Okay.
Yeah. And I like to involve everybody, but
Cool.
everybody does them differently. So,
Okay.
and then you'll see all these vaccines right here. This is what we give during the 2-month well child. Pediatrics is a combination of 3, which is a big perk. I love it. I wish they did more of these in combinations, so there's less posts, but I don't get my ways. So pediatrics is DTaP, Hep B, and IPV right there. And then we got the hip, pneumonia, and rotavirus. So, and then if we stay on track with the vaccine, 9 months, they get a break, unless parents want to wait to do the flu vaccine then. So there's one less break at the 6-month well child, because that's when we first give the flu vaccine for the infants or kids. And then at 1 year, we do the live virus, is the MMR and varicella and Hep A. And then we'll do it again at between 15 and 18 months. And then again at 2 to 3, or no, excuse me, the 4 to 6. So that will, after the year and a half, parents get really excited that they can wait a few more years down the road for vaccinations, other than the annual flu if they want to do it. So, and I like to tell parents, if they say no to the first year, the MMR and varicella, I tell them that this is a required vaccination for school. So it's up to you, because they require you to fill out this long form every year of a kid's school year. So one more visit, long hour for you to do. If the parents are willing to do that, doctors it's okay to do that too. And then that was pretty much it. Am I going too fast or confusing anybody? Okay. Right, documentation. So me personally, I don't document anything until I actually do it. So the orders are sent through and everything like that, but I don't confirm that I actually given it. We have a second scanned document that parents sign the consent form. So I have them sign it right before I actually give it to them, just to make sure that the parents haven't changed their mind. Because if they did opt out on any of them, I have to get a new form for them to re-sign. And then we do scan it into our system. And then we also use child profile. So is anybody familiar with child profile?
Yeah.
Yeah. So it's the immunization record throughout the state. So anywhere in the state of Washington, if you've gotten vaccinated, we can pull up the information through the state and see what record they've had before. And then if they got into your office, we have to update that as well. So then that way if they decide to move away to a different county, then that county can look it up. Make it really easy for transportation in case those parents decide, mistakenly misplaced that paper, that little green card, or lost it. So that way we can have it one more source right there.
The military did that many years ago.
Yeah.
Our son was through a military hospital, and it was a wonderful system in that regard for vaccinations and different medications that he had been administered throughout the years. And I mean, granted, he was only in for 3 years, but it was great because, of course, in the military you move on a regular basis. So it was wonderful throughout the United States or wherever we went.
That's cool. I really hope that it goes nationally, shared nationally. Yeah. We also learned that if adults, we can look them up as well. It's a hit and miss. Not everybody does it. But if adults don't remember if they had their last pneumonia or something like that, then I'll try and look it up there. And I've actually been lucky once to find something like that. And that's really important, especially anybody who's compromised respiratory-wise. So cause we're like, taking the chance of like, do we give it? Do we not? They said that they had it, so we have to trust that person, but we're like, next thing we're like, okay, well, which one? Because if it's before 65, we've already figured out is the pneumococcal 23, but then if they're over 65, we give the booster, that's the 13, so PCV 13, and so that's a toss-up right there. And there is a requirement algorithm, which one that we give first, based on their health and history. My thing with right documentation, so I was working with a new provider. It was one day. It was a 1-year well visit. I ordered the wrong one. It was MMRV, which we don't give until it's the second course, between 4 and 5. But I gave the right vaccination. So the thing that saved me was that I peel off the stickers off of the vials and I stick it onto the consent form next to the signature, and I also filed it correctly on child profile. So the only thing I did wrong was I ordered it, and then the computer didn't catch it because usually there's a pop-up flag like, oh, they're too young for this, but for some reason it just didn't happen. So I learned my lesson there, but I think that I gave the right vaccination because the chance of me giving the wrong vaccination is just huge. So that was my mistake, and then recognizing it, admitting to it, and then you learn your lesson. But if I did give the wrong vaccination, we would definitely report it, consult it with a doctor, tell your manager if we have to do an incident report. This happened like 3 months ago. So if the child didn't have a reaction or anything like that, then I'm lucky. And then then we have to talk about, well, do we start over with the vaccination because it was an inappropriate dose. So, yeah, there we go. I'm opening up to you guys.
Actually, the MMRV can be given as the first dose. It just causes fevers. And if the mom absolutely will not vaccinate the child if there is 2 shots, you can use it. They just don't want you to. That's why it didn't pop up for you. It would have been legitimate. It's just that it causes fevers, and so they don't want to use all the little ones.
Yeah, we have read that little inlets that comes in every box of the vaccination will have little warnings. And one of the biggest ones that I've noticed is it wasn't clinically tested for it. So that's why we have certain vaccines for certain age, certain combination vaccines for certain ages too. So at 4 to 6, we do the kindergarten vaccine. So MMRV is combination, and then the Kindrix, polio and VTAP. So we had somebody actually give the Kindrix somebody younger than the age required or requested, and it just said that it's not going to hurt the child, but it's just not tested. So we would have to keep a closer eye on the child to see if there was any major reaction. And again, we would have to repeat that. Because just for confirmation, make sure that they're building the right antibodies, protecting their immune system. But that's not my call; it's the doctor's call. So wait till the doctor says so.
When you've gone there, you get a chance.
Yeah. Yeah, exactly. And then, I don't know, parents remember me too. So I haven't had any mothers say no to me about it, but they remember you. I think I remember them. So if I made a mistake, then I remember. Okay, so some resources I got here on YouTube. I got some videos, and so whenever I train anybody new and that's never worked in pediatrics, I give them all of my info and resources. Like, do not doubt yourself. Ask somebody for help. If you want more information, you can learn it on your own. One of the main websites that I use is the CDC. All these links right here are all the handouts that I gave you on the CDC. And let's see here, I have a video from YouTube from Penn and Cal. So this one has dirty language, like adult language, not dirty, but adult. So I don't know if you like them to be present. I would say
Rated.
it's not rated R. I would say, like,
PG-13?
yeah, like PG-13, I would say.
Well, we could go out in the hallway.
Yeah.
Would you like to do that, sir?
Or we can not watch it, and then I can just, I can forward it.
Yeah, there you go. Well,
Yeah,
you
okay.
said to go.
Been fun knowing you.
Okay, it's not showing up. But this really gives a good idea why we want to vaccinate and the frustrations that a lot of us go through. Maybe some of you guys have already seen this. Whoa, it's like glitching.
Looks like that.
Am I going too fast or? I think it's going too slow. Here we go.
Vaccination causes autism in one out of
Can you hear that?
110 children. Fuck that. Total bullshit.
Oh, good call on that, by the way.
Yeah.
Keller's group gets full vaccination. My group does. I'll use this plexiglass to represent the vaccination goal. That's bad. My vaccination wall stops one of the children out of line. That's our 1 in 110 with autism. In the 1920s, before the diphtheria vaccination was common, there were 13,000 to 15,000 deaths a year from that disease. If you got it, your chances of dying were about 40%. In 1952, just before the Salk vaccine became common, there were about 58,000 cases of polio. If you get unlucky, you might end up permanently disabled or dead. Meningitis, hepatitis A and B, flu, mumps, whooping cough, pneumonia, rotavirus, rubella, smallpox, tetanus, chickenpox. Chickenpox. We have vaccinations against all of them. Which side do you want your child to stand on? So even if vaccination did cause autism, which it fucking doesn't, anti-vaccination would still be bullshit.
I need to go find that.
It's actually an old video, but it popped up like through Facebook like a year ago, and I saved it and shared it on our Facebook link. So I mean, it really opened up a lot of things, the conversations. You know, MMR was supposed to. They said that it led to autism.
And now they're backpedaling that information.
Yeah, I just saw that today, and I
Now
was
they're
like,
rapidly fast, very.
so, I give, we're advocates for the patients, but I give all of my information to the parents, and then,
Including this one?
What? This one, no, I haven't told any of the parents yet, but I'll give them other resources. Yeah. Yeah, and I'll forward this to you. I'll pop it onto your guys' Facebook link. And if that doesn't work, I'll forward to Dave so that way he can send out to you guys through your personal emails for all the different resources. So aftercare with vaccines, we like to give them stickers. We're not going to give them candy anymore.
That looks like a car that belongs in Bellingham.
Yeah, I saw that. It was just great. So one of the handouts I've given is the ibuprofen and Tylenol dosage calculation. So I give that out at every visit in case the parents lose it. I always tell them it's good to give to family members, give it to grandparents, put it in the refrigerator, so then just in case, for any reason, if they do develop a flu, or not flu, fever-like symptoms, then, I don't want to print. I'm sorry, I'm getting to a habit. I saw it and I was like, print. I know, print. So, and then one of the well-visit forms I printed out here, we give this out for every visit as well. Just gives the vitals on the patient, height, weight, head circumference, parents love it if they do the whole scrapbooking thing, or just to know how their growth is, to look back on all the other visits. And I'll just attach it to that, and then and it shows the weight on there too, so then that way they can coordinate it with this little table. And they're, what was I going to say? Nope, I lost it, sorry. My parents are they're nice about it. You know, if they don't want to keep it, then they can just throw it away. But I feel like I'm doing my part to give them all the information that they need. And then this is the link that we use for the well visit forms. They're super handy. It also comes in Spanish if you have any of the family members. And for every well visit, I'll click on it, print it, and then it'll give out all the different vitals. On this form, it'll tell you what to expect, how your baby should develop, you know, some facts that to help parents out and what they can do. Just reassurance, and then just something to read. Good stuff. Some questionnaires. So we don't use those questionnaires until they get into the teen part. But you know, if you have a parent that's concerned about, you know, where their child should be, I would print this off and like, oh, you know, here's some questions, and fill out and see what happens. And that way, those are triggered questions, so then that way they can ask the doctor. So yeah. Let's see. That's it. Do you guys have any questions so far before we get on the hands-on training? No? I'm excited. So I don't usually like to restrain people. But I have natural...
But she's good at it.
I have natural strength. I'm told. Natural strength. The only person I like to cause pain to is my husband. I'll just leave this in case if you want to get back on it. So we'll just do a review again on the vaccine. So for the first Hep B, the child will get it if parents agree, is at birth. And then the next one will be at 2 months. So I always go the same routine, so then I know exactly which one I gave, just based on memory, and then that way I can recollect where I give it, because it makes a big difference if they had a reaction to which leg. Then I'm like, oh, well, it could be these vaccines right here. So on the left leg I give 2, and then on the right leg I give 1 at 2 months, and then there's the oral vaccination. So I'll do Pediarix and Hib on this leg, and then the Prevnar 13 on this one, and then the oral one. So I'll give the oral one first because it's just comforting. We'll just like ease into it slowly. And then I'll lay the child down onto the table afterwards, and then, you know, clean the area, you secure the legs and arms, and then you give it. So I don't have a doll or anything like that, so I can give an example.
Do you have the parents secure the arms and upper body?
I do.
Yeah.
If the parents are not comfortable doing that, because I'll tell them beforehand, before we even hold the child down onto the table, because a lot of times they can feel anxiety from the parents. So I'll have them hold the baby for a while, and we'll finish talking how we're going to do it. And if they're uncomfortable doing it, then I'll have somebody else come in. I've had parents excuse themselves and go wait in the lobby until we're done. So, yeah, it's really important that you hold the wrists, not the hands, because it's easy for them to slip out. So you really want to hang on to the wrists. You can hold them across like this and hug them, and then the parents can go over them and hug them and talk to them, or I'll have them hold over the head because they don't have that upper body strength yet. So, and then I'll secure the legs. I'll pull them down towards the edge of the table, kind of like, so say this is the kid, and then their legs are hanging out. I'll pull them down, and then we'll bend the knees like that, and then I will lean up against their legs, and then I'll give them just like that. So it's trickier with infants because their legs are short. So I've had held their legs together, push the ankles together or knees together with one hand, and then I'll give them with one hand. So, yeah, and then let's see here. So we'll go all the way up to 1 year. So MMR, varicella, and Hep A. Hep A goes into the thigh, and I'll give them the left leg, and then I'll do MMR and varicella on the back. So I do IM first, and then the sub-Q, and then for me it's quicker, but whichever way is easier for you guys, then that's how we'll do it. And we'll finish through. One thing about influenza though, if it's the first dose, and if they choose to give it at 6 months, with 2 folks in each leg. But if they wait a little bit longer, so say if they haven't gotten a flu vaccine yet and they're already 1, you can give them the flu vaccine at 1 with the MMR and varicella, but then we just have to wait a little longer for the flu vaccine, the second dose of it. And you can give them at the same time. I'm trying to remember. Yeah, and then somebody said that not to give the flu vaccine with the pneumonia in the same leg, it's more painful. I don't know if it's the same for you guys. Yeah, I do the pneumonia alone because I'm told it's more painful. I don't know why. It's just we have a lot of parents tell us that there's more of a reaction on the pneumonia. So one of our main nurses, she just told us don't mix the 2 because it'll be more painful that way. So
Good to know.
yeah. So I think it's because it's cold a lot of times.
Well, all of them are coming from the fridge. if
Yeah,
not
the fridge, but the freezer, the MMR and varicella comes from the freezer.
They
So-
burn.
Yeah, and I think that's why, because it burns more because our body temperature is warmer than the freezer, right? And also, I don't draw them up until doctor comes out and says, yes, give them. Because there is a time limit. Once you draw them up, like the MMR and varicella, you have a half hour to use it, otherwise it's not as effective. And the same thing for the other vaccines. I don't draw them up unless I'm told to. And then we try not to, if we can't use it, we'll put it back in hopes that somebody will use it within an hour. If not, we have to waste it. And then that's money out of the office. And then,
And they are expensive.
they are expensive. Yeah. And then, I don't know if he'll be a volunteer, or somebody can be a volunteer if we want to work with
For what?
for children.
Oh.
vaccines, how to
What are
secure-
they volunteering for?
Yeah,
Oh, yeah.
get vaccines.
Adrian would love to.
Yeah.
He says that he
What?
won't really give you a shot.
So, when somebody like him, I will
Okay,
ask
Adrian,
him,
go on.
like, and they'll ask me a lot, I get lots of kids asking me, like, am I going to get a shot every visit? And I'm like, no, I won't give you a shot. Talk to the doctor. Because I feel like I'm the hitman, and I just tell them that the doctors are the monsters. They're the mocking bait. I don't do unless they tell me to, yeah. And then someone from will ask, and if they do, I'm like, I'm not going to lie to them. I'll tell them, yes, you are, and I'm sorry, but it'll be really quick. I'll make it really quick. And I'll ask them too, if he, like him, if he's old enough to make an option, I'll say, do you want it in the leg or do you want it in the arm? Make them feel like they, give them the power, for sure. If they're, a lot of times, once I put my gloves on, they get really nervous, and I've learned that they associate that a lot, the color of my gloves, that something's coming. So, for good customer service, you don't turn your back against them, right? But for me, I just have it all ready before I turn around and have everything out, my tray. So one of my tricks for some kids is they can drink water while I do the vaccination. It's a good distraction. Yeah. So they're on the hot spot. They're like crying and shaking. They're like, oh my gosh. Got the mom next to them or dad, holding their hand. Like, well, because they're so nervous. The chance of them moving away, that means if I was in their arm, I have to poke them again. And then the chance of me not getting all of my vaccines in there, if it's squirted on the outside of the arm, I have to get a new one, and then the needle's no longer sterile. So I have to start all over, and then we have to spend more time in there. I'll say, like, oh, are you thirsty? I'll give them water. I'm like, you drink this well into it, and then you'll be done. And that's a really, really good trick that we've done.
Have them put gloves on.
Yeah.
Lots of times that'll help, when they've got gloves on too.
Ah.
Yeah.
Then they feel like they're part of the whole situation.
I've had one girl, she loves them. She asks for them all the time. And I'm
I like
like,
to blow them up.
yeah.
Like,
Oh, I thought you were talking about shots.
No, shots.
Oh.
I've had this little girl, she'll ask for them. She likes them. She doesn't get a reaction. She'll watch you for a while. She's so tough. I'm just like, wow.
one trick I have for speed is that I learned from one of the gals at work is to have the Band-Aid on your glove already healed so you're not fumbling with that. It's just quick stick.
Yep.
Yeah.
Yeah.
And if you tell them what they're getting the shots for, you don't have to go into a lot of detail, but I had a screaming 5-year-old, and he gritted his teeth together because he was getting a tetanus shot. He goes, "Oh, I wouldn't want to drink water like that. I'll have the shot, please." And then he went from totally fighting me to sitting there completely quiet because he had a glimmer of what the disease that he's getting the shot for.
Yeah. I've had parents stand next to the kid, and then, so if you know they're going to like jerk away, especially when they're older and you're trying to give them the Deltoid, I'll have the parents stand next to them, right next to them, like right up next to them, so then that way we can work with each other, right?
Oh.
So then that way they're not leaning away too far. Let's see. Those are the two main ones that we use pretty often.
You talked about the baby's legs hanging over, but you can do that for up until they're old enough to just sit up and take it. But, sorry. But,
sit up and take it. Be a man.
But to bend their knees over, and then instead of using your chest, because of that, our tables aren't conducive to that. They're a little too high to do that. But you kind of trap their ankles or their calves in between your knees, and then you're using your body weight up against their knees. So they're not, that portion of them isn't going to go anywhere.
Yeah.
But the kids are always stronger than you think they're going to be. Always stronger than the parent thinks they're going to be.
I've had a kid, a 5-year-old, buck me off.
Yeah.
Literally buck me off, and I was just astonished. So,
yeah, they are stronger. You got to tell the parents they're going to be really strong. You really have to hold them because they won't anticipate it and they'll get out.
yeah, exactly. What else was I going to say? I think those are my little cues there. I'm trying to think of anything else that I've encountered, but I think I'm going to talk about it
As
right
long
now.
as they don't get up and run.
Yeah,
Or
we
jump on
had
top of the
kids
cars
run.
in the parking lot.
Yeah, we had runners.
Yeah, we had runners.
Well, you know, we have a runner. I've had a kid hide behind the table who refuses to. One of the hardest one is if the kid is mentally challenged.
Yes.
That's the biggest one. One thing I will never do again is I have some moms that are like to coddle their kids so much that I'm like, oh, can I have them sit on my lap? And then I'll hold on to the child. I'm like, oh, I don't know, because the chances of them of not holding them enough, and then they're like,
It's probable.
yeah, it's such a big risk. The chances of hurting the child, hurting the mom, hurting yourself. I've had one associate, he said he'll never do that again. So the kid was, I don't know how old, but I mean, you can, a lot of people have been successful about it, where the mom will sit here, have the kids sit on their lap, and then have their legs between here, and then you just kind of have the parents put their knees together so they don't move.
And then straight jump it with their arms.
Grab the kids' arms, have the kids go like this, and then lean back onto the table. So then that way the legs are all exposed, right? But I gave it a chance for this one child, I would say like 4 or 5. And it was so unsuccessful because the kid would just kept on slipping out of her arms, her hands were in the way. I told mom, like, please hold the hands up here, but she was holding it down here so she can still grab onto me. And when I had the needle exposed, I was like, I can't do it. Like, please, let's try it my way. It'll be so much quicker. It'll be safe for me, safe for her, you know, and we don't have to keep on struggling with this. So, because then I'm just putting more fear into the kid and giving them all more anxiety. That's not over yet. Yeah, that's pretty much it. If you become unsuccessful, just come back when mom and parent or patient is more ready.
Well, sometimes the kid responds better to the dad or to the mom. They have more of a calming influence on the child.
Yeah, Kevin is one of our, and he's our only male MA in the office, and he's had the best responses from kids. They'll just look at him and they're like mesmerized. I'm like, oh, they don't look at me like that. I don't get it. But yeah, it's a sense of tone and I think the authority.
Yeah. The more you let them know, though, and the more you're straight up with them, the better off it is. Don't ever lie to them.
Yeah. I think Justin one time said that he told a kid how it wasn't going to hurt and he was forever remembered as a liar. So every time the kid comes in and sees Justin and points out, like, you're a liar, it didn't hurt.
Not letting that
Or
go.
they say that in the grocery store, or Kmart or something. Ah, that person hurt me! And everybody's staring at you
Yeah.
like,
Right.
So, once I put the vaccines into a toddler, I'll have everything ready, and then put the pants up right away, and I'll tell mom, like, pick them up right away. That sense of security and helps them stop. There's a video out there that some doctor holds them a certain way and helps them
Oh,
stop.
yeah,
just recently.
the middle.
Yeah.
Yeah.
I had a parent try it, it didn't work. So I totally forgot about it. I was like, oh, I was supposed to try that, but
Yeah. It
let me know if that
was
works for you
quite
guys.
interesting.
It was.
It was on the doctors,
Mhm.
just a couple of days ago. It was
Mhm.
very interesting how he wrapped the infant, I mean, it was an infant, but around, and then
Around
put
themselves,
him,
really.
yeah.
Yeah, they were straitjacketed
And then
themselves.
he propped
Like
him up
forward.
this way and then leaned him forward and
Shook them up for a
I
bit.
could tell
I mean, not in a bad way,
him
but
a little
yeah.
jiggle
Yeah.
jaggle and
Yeah.
that kid was
They'd
about
stop
as
screaming.
quiet as they could be.
Yeah.
Yeah.
It was quite impressive. And I thought, it's worth a try.
Yeah, I'll try it if I remember, but that's how I did.
Yeah.
Um,
I was impressed.
Yeah, after feeding them, breastfeeding them afterwards. If they're a little older, parents will bribe them, like, oh, you get ice cream, or you get this.
Sticker, or...
I will give them the sticker right away and allow them to be like, oh, they get so preoccupied with picking out the sticker.
Yeah.
And like, you did so good, you get like 2 more. So
Right.
there's
and the
that.
fireworks stop pretty quick.
Yeah, or I'll pull out a glove too if they want more, because I'm limited on supplies. So. My last one is a stick. Chunk of Arthur, so.
I'm impressed.
Yes.
There you go.
And I had made a kit for one kid once, so it came in a little bio bag, and they get to hold it out. And as they're walking down the hallway, they're like, look what I got. So it makes it more memorable that way. Do you have any questions for me at all? Did I confuse you on any of this info, or if I need to be corrected on anything?
Good info.
Yeah. Yeah.
Don't be afraid to tell the parents, like I had a dad look me in the eye and say, well, polio's been eradicated. And I'm like, no, it hasn't. It's been vaccinated into the dark corners of the nowhere, but it's still here. And he said, I had no idea he wasn't going to get his child vaccinated for polio. And I talked to him a little bit about post-polio when the child was 70, and it turned out he had a family member that had post-polio.
Oh.
And he got the child vaccinated because he was totally convinced it didn't exist. So sometimes it's just, they really,
Education.
every time you can do education. And if they don't want the shots, they take the viz forms home and just read them when you get a chance. And then you never know when they're going to come back and have something to say.
It's hard because the U.S. is such a big sponge for different cultures and ethnicity. We can protect people within the U.S., but when we have so many international people coming in and out, we can't control that. And then lots of third world countries, they don't vaccinate because they don't have the right funds for it. So it's really, really important for us to think about that too. It's really hard because, we're in our own world, we're doing our own routine and whatnot, so, yeah.
And I think Americans are probably more that way than.
In our own world?
And, one of the biggest things when I encountered with a dad, when I said HPV. So we do the HPV vaccine starting at 11.
11?
Wow.
Isn't it 9?
No, 11.
They say you can start using at 9.
You can at 9, but it's not, it's 11's when they.
Because I thought 9 was the new thing where they realized, okay,
It
we
depends.
can start them here at 9.
Yeah, you can start them at 9,
Okay.
but it depends on the doctor if they want to start them that early or if they're even active at that point. But 11 is when we started,
Okay.
and it's a 3-course series. There's new studies out now, and they have a new vaccine for it. So I was talking to a dad, what vaccine this person needed. It was his daughter. And then I said, it's optional for you if you want to do the HPV. And he's like, what's that? So when I said the human papillomavirus, protecting them in case it becomes sexually active, and he's like, my daughter is only 11. And I'm like, well, the chances, I didn't want to go into too much detail of it because then he's already upset. But it's really good to let them know, like,
It's a cancer vaccine, and
Yeah,
that
it's-
doesn't.
it's
They'll
scary
agree
thought.
with them.
Yeah, it's a scary thought to think already that your child's already having sex, or even
Thinking about it.
thinking about it.
Even if they're not, it's
Mhm.
still gonna get them protected for when they do.
Correct, yeah.
And they can't have past 18.
So we push cancer
Actually-
vaccine. You can, but the state doesn't.
Oh, the ones we provide don't, okay.
Yeah, the insurance doesn't cover it
Right.
if they're older than 18, so that's why there's such a huge window
And
for
so
it.
do you do both boys and girls at
Mhm.
that,
Yes.
at that age?
As
Because
long as
boys-
it's Gardasil. The other one is not approved for boys.
Because it's not just,
Because it's oral, and it stops the oral human papillomavirus, because that's what the guys
Oh.
don't remember.
the
Gotcha.
vaccination's not oral, but it stops.
No, but
yes.
it stops the.
But it stops the oral.
Throat and
Got it.
penile
So it works
and.
super.
There's a
Yeah.
lot of things, and we just been pushing that. And I just had a meeting with the schools in Whatcom County. They got a group of us together to talk about vaccination, so those forms that come from the school make sense, and they don't all come in different forms, and you have no idea what they're talking about. Starting September, the second varicella will be required for 10th, 11th, 12th graders to get in, stay in
cool.
school. So that second varicella is going to have to really be pushed this spring when we're doing those.
So
work
that's
visits.
Whatcom County, not necessarily
That's
Washington
Whatcom
State?
County.
Thank you.
But it's going to come down, the one woman that's in charge of all the schools in Whatcom County, she said it's coming down from the state pretty darn quick. So, but it was nice to know, and they're working, this group is, we're trying to get a form that can come to you so that you know what the school's got. And so, yeah, you might have two varicellas down. The school's looking at it as one doesn't count, was too early, or I made a boo-boo the other day. I gave a child a varicella and hadn't looked at the spacing to the flu mist. So he's
Yeah.
going to have the varicella again. It's too close to it wasn't enough spacing between the flu mist and the varicella because of the window. So that's just something that is coming down the pike.
Yeah. You're talking about you maybe hearing more on TV.
Unless they haven't had chickenpox naturally.
Correct, but it has to be documented. It can't just be, well, they were really
I know
sick when
they
they were
had
4.
chickenpox, right, okay.
And if it's the first dip of the HPV, girls have more of a side effect of dizziness. So naturally, for any new medication or vaccine you give them, you'll wait a little bit to make sure they're not having a reaction right away. And I'll tell that to parents, like, I'm sorry, stick around a little bit longer, but we want to make sure that, your child's safe. And for any reason after this you leave, if she or he feels dizzy, stop, sit down, and just wait.
Meningococcal is doing that too, especially to the boys.
Is it?
Yeah.
Don't know why. It's more the boys than the girls.
Well, I think it's,
Some of it is,
Sorry,
yeah, they get
Anthony.
themselves worked out, but we've seen it. Meningococcal probably more than any of the vaccines.
Yeah, and then I've told parents, gum is really good to keep around in the pocket in case because you're waiting forever in the doctor's office and waiting room and in the room. So in case if you've gone without food or water for a bit, it's always good to have gum in hand. And then in case they do get dizzy, so it's good to have pretty handy. Yeah, I think that's pretty much it. I think I covered everything. And don't be afraid about vaccinations or even being pediatric. I personally did not want to go into peds. When I was going to my practicum, I did not want to do it. I don't have kids. I didn't know how to interact with them, because my husband has told me that when I talk to a 5-year-old, I expect so much out of this 5-year-old, and I was talking to them like an
well,
adult.
good for you.
I know. Well, I'm just trying to remember how my parents treated me, But I was telling my husband, it's good because then they build the vocabulary and the condoms, how to talk to an adult that way. But it was what I've learned is I have to figure out a way how to relate to them. So I'm trying to keep up with
Giving them shots. That's a good way.
they can build trust with you. So cartoons, what they're into. I'll look at their shoes to see what they like and what they don't like. Superheroes are the biggest thing, so I've kept up with my Marvel characters.
I'm impressed.
Yeah, so it's good that way. And then, practice for sure. I did a routine in peds for 6 weeks until I got everything down. and I know, and I still, to this day, I still have a hard time remembering all the vaccines, because, you're not exercising enough, then you will forget.
Well, thank you very much.
Yeah, thanks for having me, guys.
Wonderful.
Yeah.
Thank you for making
Thank
the
you.
trip up.
Yeah.
See?